What are modern biologic asthma treatments? Imagine a treatment that targets exactly what causes your asthma symptoms instead of just easing the symptoms themselves. That's what modern biologic asthma treatments aim to do. These advanced medicines are designed to zero in on specific parts of your immune system that trigger inflammation and airway narrowing. Unlike traditional asthma medicines that broadly reduce inflammation or open your airways, biologics focus on particular molecules or cells involved in asthma. This makes them a more personalized way to manage the condition. They are usually recommended for people with moderate to severe asthma who still have symptoms despite using standard controller medications like inhaled corticosteroids and long-acting bronchodilators. If you often have asthma attacks, wake up with symptoms at night, or need oral steroids frequently, biologics might be a good option. There are several types of biologic treatments available, each targeting different pathways in the immune system. Omalizumab, also known as Xolair, targets immunoglobulin E, which is an antibody that plays a big role in allergic asthma. By blocking immunoglobulin E, this treatment helps prevent allergic reactions that can trigger asthma symptoms. Mupalizumab, called Nucala, Ruslizumab, or Fasenra, focus on eosinophils, a type of white blood cell that causes inflammation in certain asthma types. These biologics block the activity of a molecule called interleukin-5 or its receptor, which reduces eosinophil levels and the inflammation they cause. Dupilumab, known as Dupixent, blocks the effects of two proteins called interleukin-4 and interleukin-13. These proteins are involved in both allergic and eosinophilic asthma, helping to decrease airway inflammation and mucus buildup. Tezepelumab, or Tezspa, targets a molecule called thymic stromal lymphopoietin, or TSLP. TSLP is involved in both allergic and non-allergic asthma, so blocking it can help control symptoms in a wider range of patients. Most biologics are given as injections, either with a prefilled pen or syringe, usually every 2 to 8 weeks depending on the medication. Ruslizumab is an exception, as it is administered through an intravenous infusion. These treatments are not meant to replace quick relief inhalers used during asthma attacks. Instead, they are used regularly to prevent symptoms and reduce the frequency and severity of flare-ups. Doctors usually prescribe biologics after reviewing your medical history, asthma type, and blood test results. In summary, modern biologic asthma treatments offer a targeted way to manage asthma by focusing on the immune pathways that cause inflammation and symptoms. They are especially helpful for those whose asthma is not well controlled with standard medications.